Can you give a little bit of information about why you chose spine?
So I'm a consultant spine surgeon that practices at Bangalore Hospital Group in Bangalore. So spine surgeons, there are two types of spine surgeons that we know. Like, somebody with orthopedic background and somebody with neurosurgical background. Both of us, both of the specialties have access to do spine surgery. And obviously after orthopedics, you subspecialize in spine surgery. In orthopedic background, we have something like a fellowship trained orthopedic spine surgeons, where you have like 2 years, 4 years fellowships that you do in different parts of the world. And once you are confident about your skill strength, then you start practicing on your own in the outside setups. So for me, particularly after my orthopedic training in Coimbatore, I was very much interested to initially learn the basic orthopedic skills at one of my favorite hospitals called Ganga Hospital, Coimbatore. There I practiced for a couple of years, mainly, subspecializing in trauma surgery. So always my boss used to tell me in the past that when you have your basics correct, then you can always try and do the very high-end stuff like spine surgery and all. Because orthopedics is mostly a kind of a very refined carpentry work, I would say. You need to know the biomechanics of every bone that you're dealing with. So in the same way, like you shove a lot of screws in, shove a lot of nails inside the bones. If you don't really have that fine carpentry skills, then it's always difficult. So from that moment, I decided that the passion for spine surgery started for me during my post-graduation time in Coimbatore. I was attending a lot of spine cases along with my professors at that time. And one thing is I like to spend a lot of my time in the operating room. So I used to find a case that goes the longest and wash in for those cases, help them, assist them.
Oh, I was the opposite of that.
Yeah.
Really pick the short ones.
But, I feel like, good when I used to come out of the operating rooms after 8 p.m., 9 p.m. rather than, go out of the operating rooms much quickly. So that's probably the reason I started attending the spine surgery cases. And once I started to do that, it was very much, comfortable for me how the surgery was going. Like initially it was completely like black and white. It was not so clear on what we are actually doing. But as you spend more and more and more time, initially during the post-graduation period, then I started to understand that spine surgery is something that requires a lot of skill and a lot of dedication and a lot of focus and concentration. So following these things, and obviously these are very long surgeries, and then once we started to come out of the surgery, then the patient started to feel really better the next day. They're relieved of their pain, they're relieved of their numbness in the legs, and those things happened very quickly. And the kind of satisfaction you have when you go for the rounds on the next day, it is really nice, good feeling that I used to have. So that's where I think the passion for spine surgery has started.